Why is preventing E. coli crucial for avoiding UTIs? Imagine bacteria that normally live harmlessly in your gut suddenly causing trouble in your urinary system. That's exactly what happens with E. coli, which is responsible for about 80% of urinary tract infections. E. coli is a bacteria that usually resides in the intestines without causing harm. But when it gets close to the urethra, especially near the opening of the urinary tract, it can make its way into the bladder. This often happens because of fecal contamination, which can occur if personal hygiene isn't maintained or if bacteria from stool come into contact with the urethral opening. Once E. coli enters the urinary tract, it can stick to the lining of the bladder using tiny hair-like structures called pili. These pili act like hooks, helping the bacteria attach firmly to the cells lining the bladder. The bacteria also produce biofilms, which are protective communities that shield them from the immune system and antibiotics. This makes infections harder to clear and can lead to recurrent UTIs. E. coli can also produce toxins that damage the tissues of the urinary tract, leading to inflammation and discomfort. If the bacteria reach the kidneys, it can cause a more serious infection called pyelonephritis, which can be quite severe. The bladder's lining normally acts as a barrier, with a layer of mucus that helps prevent bacteria from invading. But when E. coli overcomes these defenses, it can cause infection. Repeated or chronic infections can lead to ongoing inflammation, which is a risk factor for bladder problems and even bladder cancer. Chronic inflammation can damage the bladder tissue over time, increasing the chance of abnormal cell growth. Preventing E. coli infections is essential for maintaining bladder health. Good personal hygiene, such as wiping from front to back and washing the genital area regularly, reduces the chance of bacteria reaching the urethra. Drinking plenty of water helps flush bacteria out of the urinary system through regular urination. Avoiding irritants like harsh soaps or chemicals that can damage the bladder lining is also helpful. Some people consider probiotics to support healthy bacteria in the urinary and vaginal areas, but research on their effectiveness is still ongoing. If you notice symptoms of a urinary tract infection, such as a burning sensation during urination, frequent urges to urinate, or cloudy urine, seeking prompt medical care is important. Treating UTIs early can prevent complications and reduce the risk of chronic bladder issues. By keeping bacteria like E. coli in check, you help protect your bladder from infection and inflammation, which supports overall bladder health and reduces the potential for long-term problems, including bladder cancer. Remember, always consult with a healthcare professional for personalized advice and treatment options.